Hello, you may recognise me. I'm Dr. Andrew Green, one of the doctors at this surgery, and I wanted to take a moment to explain some of the changes that have taken place in the last 2 years at Malago. As you may now realise, when you book an appointment to be seen in surgery, you now have the option of being seen by one of our advanced clinical practitioners. They work alongside the doctors, providing a consultation service for many of the conditions that in the past would have been managed by a doctor. We currently have 3 advanced clinical practitioners. I wanted to explain their role, what they do, and why they are here. The first thing to say is that they are not treatment room nurses. Our treatment room nurses are highly trained and, as many of you will realise, already run many of our chronic disease clinics for conditions such as asthma, diabetes and hypertension. But they are not trained or qualified to consult in the way that doctors do. Our advanced clinical practitioners were originally nurses and paramedics, but unlike our treatment room nurses, they all have additional medical training that qualifies them to consult, diagnose and prescribe. They're not a new phenomenon in the NHS. If you've ever been seen by Brisdoc, our local out-of-hours service, or if you've attended accident and emergency at hospital, you may well have been seen by an advanced clinical practitioner and not even realised. All our advanced clinical practitioners have already had considerable prior experience, but the important thing to understand is that we work as a team and they all work under the supervision of a doctor. Each morning and each afternoon there is always an allocated supervising doctor who is able to deal immediately with any queries as they arise. This is how it works in hospital. If you have a hospital appointment, you will be under the care of a consultant doctor, but you will not necessarily see the consultant when you attend. More likely than not, you will see a member of his or her team. However, each member of that team can immediately ask the opinion of the consultant if they need to. And that's how we operate. Employing advanced clinical practitioners has enabled us to increase the total number of appointments we offer. And they have also released our GPs to deal with patients who have more complex and demanding needs. With the ageing of the population and restrictions on NHS funding, we struggle to provide enough appointments to meet the needs of our patients. Our advanced clinical practitioners go some way to helping us meet that challenge. They have helped us to survive as a practice during what has proved to be a very difficult and challenging period, and we're immensely grateful to them. In the next 5 years, it's estimated that 30% of general practitioners will retire, and there are nowhere near enough GP trainees to replace them, so our advanced clinical practitioners are definitely here to stay. So when you ring for an appointment, we would ask you not to be disappointed if you're offered an appointment with an advanced clinical practitioner. As I have already said, they are highly trained, they can diagnose and manage many medical conditions, and they always work alongside a supervising GP. Our feedback from the patients who've used them has been overwhelmingly positive, and as GPs, we are very glad they are now part of our clinical team. Thanks for listening.